So first of all, welcome to everyone. And can I begin today by acknowledging the traditional owners of the lands upon which we all meet. And I'm coming to you today on the lands of the Wurundjeri people of the Kulin Nation, and pay my respects to their elders, past, present, and emerging. Well, this reopening series has been a really important and critical piece of information sharing that has been obviously incredibly popular, but also very timely given where we are in our opening process. It's a very exciting day, and from 6 o'clock today, I know that everyone will be absolutely busting at the seams, I'm quite sure, with all of the bookings that have come through and all of the business that you'll be looking to service. I do want to thank you, and I know today's been a really challenging day for everyone given the weather and the circumstances we're operating in. Please just be aware that we are recording the session. I'll go through this in a little bit in terms of the housekeeping, but I just want you to know that after the session today, anyone who has registered to be part of the event will receive a special note with us with a link to the series. So, or I should say to the session. So if you are talking to your colleagues, please let them know. If they're not able to join in today, it's fine because we are recording the session, and it also will end up on our VTIC hub so people can look at that after the event as well. So no one will miss out on the information today. We'll make sure that it gets to everyone regardless of whether they could join us at this point in time because of the Wi-Fi situation. I just want to go through just a couple of housekeeping messages first up. First of all, as I've noted, we are recording this session, but also too, your microphone has been muted and your camera is turned off. So you don't have to worry about doing that on your system. That automatically happens on the platform. Can I also please ask, if you have any questions today, would you please put them into the Q&A box, not into the chat? I can only really look at the Q&A box and try to keep track of all the questions there. It's a bit too hard to jump between the two platforms. So please, any questions into the Q&A box. I'm going to try to kind of wing this a little bit today in terms of the questions. We saw on Tuesday when Allan spoke, there were quite a lot of questions that came through really quickly, and it became too difficult to ask the questions through the presentation because it was deterring Allan from actually getting through the content. So we ended up saving the questions to the end. But depending on how we go, we will try and answer some of the questions as we go through, but if they start to come in too thick and fast, we might actually hold the questions to the end to allow Allan to get through his session. So speaking of Allan, it is my pleasure today to welcome Allan Briggs here with us. And I want to also acknowledge at the same time and thank our partners in the Victorian State Government. We've been very, very fortunate through a grant that VTIC has received that we're able to put this series together for you. And we've been able to deliver this not just to our members, but to all the industry at no charge. And it's actually been, information that's been really critical to the industry's reopening. So Allan is the CEO of Crisis Shield, and as I mentioned, he gave us a terrific presentation on Tuesday in terms of how to manage aggressive behaviour from customers. And I know that the people online were actually quite relieved to hear a lot of the messaging and really took a lot of the tips on board from Allan. As I say, he's the CEO of Crisis Shield, and we're really thrilled to be able to bring him here today to give us another session on what to do in the event that your business is determined to be an exposure site. And we also have joining with us today, you'll see Stuart Topless' name there. Many of you on the line might well know Stuart. He's with the Department of Jobs, Precincts and Regions in the Division of Tourism, Events and the Visitor Economy. And Stuart has been a great friend of ours in really trying to work our way through all of the challenges and changes that keep coming through daily for us. So hopefully between us and amongst us, we'll be able to answer the questions that you've got. So Allan, I'll turn over to you, and thank you so very much for joining us today.
Great, thank you, Felicia, and welcome everybody. It's great to be back here again today. A very exciting day. We're all getting joined up together, and as it's 6 o'clock tonight, it's on. So couldn't have been a better time for this workshop, and really hope you get some real tips and some really practical advice to work through if you are an exposure site. So without further ado, I will share my screen and bring you up to see the presentation. So if everyone could just, anyone's not seeing a nice actually landscape there at Carbathong Lodge up at Malakuta. So one of the regional destinations. If anyone can't see it up on the screen, can you just give Felicia or Tamsin a wave to let them know?
It looks like it says all clear, Alan, so I think hopefully we're good.
All right, we'll keep going. Terrific. All right. Just by way of introduction, some people may have seen this on Tuesday. I'd just like to to frame this to give you an understanding that while I'm based in the city, I actually do a lot of travel in regional Victoria, whether it's camping, and it's actually there camping up in East Gippsland a few months ago. Obviously saying Carbathong Lodge, Wilson's Prom, Great Ocean Road, up on the Murray. So the reason I'm saying this is I do have some empathy and certainly a good understanding of your businesses, and whether that's cabins, it's a caravan park, it's a hotel. So I've tried to develop these workshops to be very practical because I understand the environment you're working in. I'm here in the city at the moment and a lot of resources, and I appreciate a lot of you are just running, maybe just one or two of you in the actual location. You're not close to a police station, or internet's patchy. So trying to work this in a very practical sense. So just let you know that. We've got 2 hours or just under. I think as Felicia just mentioned, just put your microphone on mute and we'll take questions at the end. So 3 key things we want to just cover off today is just understanding, I always like breaking the 3 phases: preparing, responding and recovering if you have an outbreak of COVID, and what procedures you need. What your obligations are as a business, it's important, and how to improve. So I always believe, we want to learn if something went wrong, what went wrong, so we don't actually have that happen again. So talk about that. You know enough about us, we're specialists in this area. I'll keep moving. First thing we want to just be very clear what an exposure site is, and it's a place where a confirmed case of COVID has attended while they were infectious. And I think that's very important. We're always quite clear about that, that they were at that location and they were infectious during that period. We remember we had tier 1, 2, 3, and we've really now, as things have sort of developed, if you like, we're really now focusing on tier 1 exposure sites. And whereas COVID has been positive cases attended while they're infectious, and other people have attended now at a greater risk of catching the virus or passing the infection to others. So if you've been a tier 1 site during that specified time and you're identified, and the new terminology we're using now, or government's using, is called a primary close contact. And I'll talk a little bit more about that later, but they must immediately get tested and isolate. And it's now 7 days, regardless of the results. So if you're a primary close contact at that time, you must isolate for 7 days. If you're not vaccinated, it's actually 14 days. So just to get clarity on that, most of you should be having fully vaccinated staff with you, and it's 7 days for them if they're close primary, 14 days unvaccinated. So yes, anyone who's been a tier 1 site, the relevant period in the high risk category are also considered close contacts. And I'll explain that a little bit further. So just a few things about the rules. Vaccinations required for major events, dining in, and guests who are seated. Currently, no requirements for accommodation, or takeaway. You do require to check in by all visitors, and that even includes takeaway. Mask wearing is required indoors. Of course, if they're sitting down, partaking in a meal, drinking, not required. And outdoors, as of 6 p.m. today, are not required, unless you're in a high density place where you can't maintain that social distance. Just the distancing, and you should be familiar with the venues. It's 1 person for 4 square metres indoors and 1 person for 2 square metres outdoors, or your capacity limits. I touched on this the other day, and as we're all aware, we've had a very long endured lockdown, impacted a lot of people in different ways. So, we don't know what's happening in their life. They've lost their job, hasn't been good on the marriage or the relationship, or homeschooling. There's a lot of things that could be impacting these people to get them a bit stressed and possibly not behaving as they normally would. It's a new world. We're all learning. You're learning, government's learning, businesses are learning, communities learning. So we're all in this sort of learning phase still, and a little bit uncharted. So I've just gotten there. Empathy is needed more than ever. So sometimes it may be easy to sort of fire up and get a bit upset or a bit annoyed with people. And then I've got to think, well, it's all very new. So we're all still adapting. So some of the key points, just want to recap, is that high exposure category must get tested and isolate for 7 days, or 14 if they're unvaccinated. If a worker or a visitor finds out they have tested positive for COVID and attended a venue while potentially infectious, they must notify their employer or the venue immediately. So there's an onus on you. So for some reason, I find out that I'm a positive COVID, I should be going back and notifying basically the people I've interacted with and the places I've been if in that infectious period. So there's an onus on me if I catch COVID. And the other onus is if you've got an on-site worker who tests positive, you must follow the steps in the kit we'll show you. And you must also notify the Department of Health that a confirmed case has been at your venue. So there's penalties if you don't do that. So you can't have the scenario you think, oh, well, they've tested positive, I'll just send them home and we'll just keep operating. There's quite a bit of compliance that you have to do, and I'm going to walk you through that today. So I just want to make that clear. There's an obligation on people who have been contracted COVID, and there's an obligation on you as a business owner. So as I said, 3 points we'd like to cover: prevention, response, and recovery. So just going, and look, I know you are familiar, but I will just step through these. It all goes back, a lot of this, to good hygiene practices and instructing staff and visitors to do that. So the mask wearing, cleaning your hands, maintaining the social distance. We talked about the elbow tap the other day, just to greet people, and staying home when you feel unwell. So those things still apply, and good practice, keep that going. Now, have your COVID safe plan up to date and considered for a daily briefing. I work a lot in this industry, work with a lot of clients. We develop plans, and a lot of people have the plans and they put them up on the shelf, and the only time that plan sees the sort of light of day is when something goes wrong. The plans are developed for a reason, and what we really encourage you to do is, and I recommend this, is each day have a quick briefing. Might even take you 5 minutes with your staff, just to make sure they're quite clear on what the current regulations are, what the requirements they are, whether it's mask wearing, the distancing. And so when people start work, it's front of mind, and that's the best chance you've got they'll actually, keep complying and doing that. If we just come to work and just get straight into work, it tends to be, oh, the COVID safe plan's on the shelf and we've forgotten it. So keeping them front of mind with that. I mentioned on Tuesday, it's worthwhile actually printing out those regulations and rules. And then if you get a client who may be just out or a visitor who's just unsure, the staff can go, look, here it is. This is actually the latest. We've just printed this off today. So the staff understand what the current regulations are, rules, and you can show the guests as they come through. So that daily briefing is worthwhile, just to make sure, and you also understand how your business will operate. For example, if you're creating zones, or you're keeping, front of house staff very separate from back of house, for example. So I'll talk about that a bit more, but once again, a good briefing each morning is worthwhile, or each shift, or the start of the day. Supporting staff and contract visitors to be vaccinated. Obviously, it demonstrated that vaccination is helping, so supporting that. And maintaining separate areas between staff and visitors where practical. Now, once again, as I said, I'm very familiar with your industry and a lot of your venues, and sometimes that is very challenging. But where possible, try and eliminate having your staff just all, for example, meeting in the staff room. They get in there at one point in time, they can infect, and then you're in a lot of trouble. So if you've got someone who's in that high contact area, and that might be, for example, at reception, try not to get that reception person to be then walking down into the kitchen, into the office, into other areas of the venue, because there's a potential of just infecting everyone. if that person's front of house, and you do isolate them a little bit, but if they are then deemed to be a positive, they've only infected them, and the rest of the staff can keep coming back to work. So it's a bit challenging, but you really got to, where possible, think about this. So we're just minimising that spread if we do get a positive case.
Allan, there's just a couple of little questions that I might try to jump into this point. First question was around what period is deemed an infectious period? Yep,
good question. I'm going to show you the matrix that's been shortly, but just a quick one I've got on the bottom there. That's a very good question. A distance of more than 1.5 meters, or if you're less than 1.5 meters from people, or your time is more than a minute with the visitor, you're then going into this infectious time. So what if I'm staying more than 1.5 meters away from people and I'm only walking past them, I'm not actually spending any time with them, I'm deemed to be in a low risk category. That's where you want your staff to be. The minute, for example, if you've got massage, handshakes, close interaction with people, I'm now putting my staff or myself in that high risk category. And if there's a positive COVID on site, you're going to be pinged, if you like, and you'll have to isolate. So trying to keep as much of our staff as possible in that low risk category. And once again, I appreciate, depending on your business, you're doing, a zip lining or something, you're in close contact, you're going to be touching in close to people, you're going to be in a high risk category. So, but where possible, your back of house, other staff, try and keep them where they're in that low risk category.
Okay. I'm going to just take this one last question because it pertains to what you were just talking about. There's quite a few starting to come through now, so we might actually hold the questions to the end because I don't want to disrupt your flow, Allan. But just the one question relating to the notification. The onus, as I think we understand it now, is not necessarily on government to notify venues. That's really the question, or is it solely on the public and staff to try to manage this now?
Yeah. Look, I'm going to cover that, so we might park that because there's
okay, good.
So make sure, great questions.
No problem. Well, let's keep going then, Allan, and we'll save all the questions to the end then, okay?
But I've got the answer. So we'll keep moving.
Thank you.
All right. Okay, so once again, we're still in a prevention mode here, is checking for the vaccination status. I think we're all we discussed that on Tuesday. I was just down with the Loom doing training yesterday. Obviously they've got the app. Some people may have a hard copy or a certificate, checking their ID. So we want to make sure they're well aware before they get to the venue that that's a requirement. Just got here, just been quite clear, you can't actually request health records, but you can go through the government app or their vaccination passport, medical certificate with exemption, and a declaration. So once again, this is very important. If they're coming in for that dine-in service or coming in to have a meal or at a bar, they'll require that at this stage. Once again, for accommodation, that is not required. And I must say, you do have to keep up to date with the health department guidelines. I appreciate you're running a business where you're now coming into a fairly busy season, and VTIC and the Regional Tourism Board are really good resources. They'll have the most current information. So they'll try and communicate obviously out to you, but if you're a little bit unsure, you want to keep on, and I recommend regularly you're going back to that hub to see if there's any updates. Now, maintaining a clean venue is good. Regular cleaning and disinfecting, and good airflow and ventilation indoors. Interesting, remember when this COVID sort of, became a thing and came into the community, there was a lot of emphasis around touch points. And I know in the city here, they had cleaners walking around wiping the pedestrian, buttons and signs and everything. We've tended to move away from that. They're showing that airflow seems to be a pretty high area of contamination. So what I really recommend, try and get that airflow going. So I know, for example, down a lot of the venues there, HVAC systems running on 100% external air, costing them a lot more to run it, but it's basically replacing all the air in that venue continually. So in your position, I'll be looking at, if you've got a dining room, a lounge, a reception area, trying to keep doors open and inputting signs, please leave the door open to keep high air, letting people know so people don't think, gee, it's a bit drafty in here, or why are you leaving the door open? So look, we want to maintain that airflow. So these are really practical things that can make a big difference. Interesting with this cleaning and disinfecting, they're two different things. I'll talk a bit more about cleaning, but there's one thing to clean, that's with hot water and soap, and it's another thing to actually disinfect. So they're two separate things. I'll talk a little bit more about that, but regular cleaning is one thing which we probably did a lot pre-COVID, but we're now going to also disinfect as well. Conduct checks on staff and visitors prior to arrival to the venue. If they're not feeling well, they're coming in, so look, if you're not feeling well, please don't come in. The other one is some companies are now doing rapid testing. It is expensive, but depending on the nature of your business, it might be worthwhile. And I know, I believe, as of next month, you can actually purchase rapid testing and do it yourself. The other thing is checking up on their wellbeing. Confirm if they're feeling well prior to arrival. And as I said on Tuesday, it's worthwhile. I feel communication is a great thing, and we've got great tools. It could be an email, an SMS, or maybe a call as they're coming to your venue, just confirming you're feeling well, that if you're not, please don't come to our venue, because that's going to happen. Or can you have a COVID test prior to arrival? Offer the guests offer to check them in on the app. Now, some people come in and you're either busy at reception, or some people just go, look, I don't want to check in. I've just got here. I just want to have a holiday. I just want to rest. That's fine. I don't know if you're aware, you can actually check other people in. I do recommend you advise the people and say, look, we're happy to check you in. So you'll check yourself in to your own venue, and you can check your guests in as well. So that means that if you have to do some tracing, you know who's been on site. So let the people know. You can do that for them. Manage first touch customer experience online. What to expect, how you will manage the regulations. So once again, the more people understand what's happening, for example, you might say, we won't actually talk, we won't come out and greet you. The key will be left under the doormat, or there'll be a sign or directions to go where your accommodation or where the meal area is, because we want to minimize that interface, which is a bit of a shift from what we're normally used to doing. In this industry, we like to go out and greet people and welcome them. In this case, we may say we're going to minimize the interaction we have with you, because we just want to lessen that interface and having staff potentially exposed. So yeah, once again, these things you can think of, and then communicating that with people. And again, so far, evidence is that people are fairly comfortable that you're taking these measures, and they understand why you're doing it. Now, very important for prevention, respond immediately if you are notified of an incident. You can't sit on the fence with this. You've got to act quickly. If you get a notification, you're going to have to dedicate one of your staff to work on this. And I think I've got later on, I'm saying put someone aside for about 4 hours to do this. It's not a 5-minute job. There is quite a bit of paperwork, if you like, to complete, but you need to focus on that. So be prepared. And I say there's a high chance this will happen. When it does, you get the notification, bang, get onto it straight away. You'll deal with it, and you'll be able to keep trading and working. If you leave it, the thing's only going to get worse, and then it's a much bigger job to bring things back. Same principle we apply for crisis management. Once something happens, act quickly. Don't hesitate, and that will bring it in much better to control. Keep good records to assist if you have an incident. That's always comes back, and we've seen that. It's hard. I know some people refuse to check in on the app. If people are doing that manual check-in, you want to keep those sheets for recording. So once again, just having that discipline around that. Consider staff placement zones to minimise contamination, which I mentioned earlier, and maintain regular and clear communications with staff and visitors. So, once we get trading and moving on, we will get a little bit more comfortable with this. And it is also a dangerous time in the sense that we start getting people from the kitchen coming out and talking to staff at the front of the house, going to all sorts of areas. And next thing, we get an outbreak and we've contaminated everyone, and they're a close contact. So once again, we've got to, and I think that regular briefing at this stage will be keen for quite some time, just to keep people front of mind of what they need to do. Have COVID safe plan and outbreak documents ready on your desktop, ready to go. You'll get a copy of this presentation, or you've got the recording of this. There's a kit will be coming out to you very shortly, hopefully this afternoon. Save it on your desktop. Save it where it's very easy to get and use. Don't, put it in with a pile of papers or drop it in the filing cabinet somewhere. You want that. Most of you will be using a computer. I'd say soft copy on your desktop. So, and just have a folder, outbreak procedure, and you can click in there, or any of your staff, if you've trained them, and you can actually start filling it out. So highly recommend that. Once again, you're well prepared if it happens, or maybe when. Just a few things once again. Ensure the rules around the COVID vaccination check-ins, mask wearing are clearly displayed. I talked about this the other day. It's on your website, on your booking, reminder, email, text before people arrive. Once again, at reception around your venue, without making it too overbearing, but just gentle reminders so people are conscious it still applies. Now, I'm going back to a bit of crisis management here. We always find when something happens, usually the facts can be a bit blurry when an incident occurs. And we usually have a lot of assumptions and a lot of speculation. So I always implore you to look at what are the facts. So if you get the notification incident, attempt to get a second or even a third point of validation. Someone rings you up and says, look, I was at your venue and I'm tested positive for COVID, and I was at your venue. All right, great. Was that during their infectious period? Do you know, how can I verify they're at my location? And we've just got a sample here. Meg was kind enough to show the wildlife she's living at the moment. It's going to IGA in the grocers. But on that service app, on the bottom left corner, there's a little, you see encircled in red there. If you click on that, that'll actually bring up this history, and you can actually ask the person to go back and check their history. And I'd even ask them to screen grab that and send it to you, because it just confirms they're actually at my venue and at what time and date, because this is very important when I'm starting to do my own contact tracing. So always try and get another source of validation. It's not just the phone call. How else can I validate you were there? Your bookings, it might going through your receipts to say, yeah, that person had a meal here. The timing, these things are fairly critical. The time they were there and what location they were at, because that can make a massive difference to what impact it is on your business. Clearly, we want to minimize that impact. And the way we do that is with accuracy. So if the person says, I was at the caravan park at this time and date, we don't want to close the whole caravan park. We want to identify where were you, what time, who else was in the park, and then we can do very accuracy about how we respond to that. Can't enforce that enough. That validation is really important. Record the details provided, work through a checklist, and log your actions as you complete them. So you should always start a log. If you've got a diary, a day book, what is it, 11 o'clock, I was notified by Allan Briggs that he'd been here on this date and time. He believes he was infectious. Bang, log that, and then we start going and keeping a good log of what's happened, what we've been notified, and what we're doing. Don't have to write an essay, just dot points. And then we've got that to go back, because when these things happen and you're trying to run the business as well, next thing a few hours have passed and you're unsure, what time did they ring? What was their phone number? So the more, once again, this mild policing comes back, a rough note is better than a good memory. So if you can just log these things in dot point, it'll prove valuable for you. Now, don't panic. These exposure sites are becoming very common. In fact, I had a look this morning. I think Victoria's got, and these are the ones that are listed on the site, 3,150 tier 1 sites. And that's not all of them. That's just the ones they've listed, are usually in the higher risk category, like aged care, hospitals, I think schools. So don't freak out and you think, oh, we've got this. It's going to become very common. And the prediction is that this is going to be even more so when we open up and we're getting more movement, and we're going to have international tourists here soon. So great for business, but the reality is we're going to be more exposed. So don't panic. It's going to become very common. Very different story to what was the start of the year, where you're probably front page of the media. Today, you probably won't even give it a mention, or maybe even not even contacted by the Department of Health. So if a COVID incident occurs, act quickly, refer to the plan. You've written the plan for a reason, refer to that, and follow the checklist to ensure you have completed all steps. And I'll show you that shortly. You may be notified of a COVID incident from various sources. It may not all be the Department of Health. It may not be the infected person. It could be a third party, a company that had one of their service people or delivery people. So don't just get in your head, it has to be the infected person or the Department of Health. It could be a raft of reasons that comes in. And this once again goes back to validating. I've got the right person, they're at the right place, at the right time. As it stayed up, as I said, we anticipate we'll get more infections, so let's be prepared. We work on the recommendation, assume you will have COVID rather than hoping it won't happen at your venue. So this is really important because everyone now should be saying it's only a matter of time. I've got the documentation, I know what to do, and you just go, yep, we're ready. So rather than saying, look, I hope it doesn't happen here, that's, work on the premise, it will happen and you'll be ready for it. Now, going through the notification process, so there are a number of documents. We have put together a checklist, but I'm just going to show you these and what they are. First one is the employer notification form of a confirmed case. So this is the form that you must put through to the Department of Health. Just clarify here, the Department of Health and Human Services has been split, and it's now the area you're dealing with is the Department of Health. So you will see, for example, on their Twitter feeds, a few things are calling themselves the Department of Health. And then when you go on the website, it's still the Department of Health and Human Services. It's the same place, it's just been split, but you may hear either Department of Health or Department of Health and Human Services. That's okay. So you need to, and there's an email address where you'll send that through, but you'll need to fill out this, it's fairly straightforward, but you will need to actually fill out this documentation. Ideally, you would fill it out online, and it's in a Word document. It's a soft copy. You can print it out and fill it out in hand, but preference is to do it electronically, and you can email it off. I recommend you keep a little folder as well. So if you had a confirmed, it's the 29th of October, I'd keep a folder on my desktop, COVID case, 29th of October, and I would put it in there, and all the documentation you fill out, you can keep a copy in that folder if you need to go back to it. Now, the Department of Health may identify close contacts and confirm COVID cases and provide them with instructions, for example, quarantine requirements. They'll be relying on the check-in app. So this is why it's so critical, because then they can track where people have been, where their movement is, and also what the person has told them. I don't know what you guys are like, but I know I'm struggling sometimes to remember what I did in the morning, let alone 2 or 3 days ago. So, and that's where you can get into trouble, is people say, look, I was down at Lawn or Lakes Entrance. Look, I went to the coffee shop, and then I think I went into the chemist, and I bought some food at there's Coles. I can't remember. So that's where they say, look, I think I actually went, I went into that hotel, or into that restaurant and stayed there, or maybe I did, I'm not sure. This is where contact tracing is so important. So getting that check-in will help you verify they weren't here, or they weren't here for sufficient time. So I've got that information. They may contact you to establish who was a close or secondary contact. So the Department of Health may, not always, they may contact you to ask who else in your business has been that close contact with those people. Record all the names you have, staff and business logged on the app, even if the Department of Health don't contact you. So once you have been contacted, and just trying to answer the question earlier, I'm now really encouraging you, you may never hear from the Department of Health. This is the reality of happening. And as it's getting more and more cases and more tier 1 sites, there's a high chance you'll never get contact with the Department of Health. That doesn't mean it's a non-event. You just treat it as you normally would. You're basically running it yourself. So you'll do the contact tracing, you'll send the close contact people home, you'll do the deep clean and so forth. So you treat it as you normally would if they had contacted you. Just because you don't hear from them doesn't mean it's a non-event. it is still a real event and you need to manage it. So always be mindful of that. You may have no contact from them and need to manage it all on your own. Now, you'll need to notify the staff who the primary close contacts are required to get a COVID test and isolate for 7 days. You have no legal obligation to notify or contact the employee's family or other people they live with. Your only obligation is that employee. You don't have to notify, their circle of friends or their family or their housemates. Only the person that's been tested or close contact. It must provide the employee with a COVID testing site. No, not you must. I recommend you give them the COVID testing site locations and times of operation. I highly recommend that you do that also for your visitors. So if someone comes up to you and says, look, I'm just feeling a little bit off color today, give them, I'd even print it out and say, look, here's the list of the locations and the times of the at least 2 testing stations that are in your area. Now, some of you will be regional and that could be some distance away, but you need to have that information. Because if you just say to them, oh, look, go and get tested, I'll walk out of the office and think, well, oh, look, I won't worry about it. So if you've given them that information, you've given them a lot of help. So, and plus, you know where they are, what times they're open. If you have staff, this is important, advise them they can only attend the testing site or stay isolated. So if you've identified a staff member is a close contact, you can't say, oh, look, you need to get tested and go home. And then they walk out, jump in their car, walk down the street, catch a bus and go home. You can't do that. You need to explain they need to get tested and then they need to go home and they need to be isolated. Now, I think you've got to use a bit of discretion here. If they've say, oh, fine, walk out, hop on a bus, that's not good. We don't want that happening. If they've got their own car, that's great. If they can't, you may have to work, how can we get that person to their home with having contact with other people? Because clearly if they are infected and they're going out and catching on public transport and going down to buy some food because they're isolating for 7 days, we're a super spreader. We don't want that. So see how we can minimize their interface with other people. If they're going to need food, once again, your staff, I think it's very important to see how you can assist them with purchasing food. I don't know how you are in regional areas, but a lot of the supermarkets, for example, will do home delivery. Or maybe you can organise that. So look, ask them to order the food and you can pick it up and drop it off. I think it's very important if we're expecting someone to go home and isolate, and they've been at our workplace, that we can support them as much as we can. It could be cleaning staff, front of house, reception, wait staff. I think it's very important if we're going to ask them to isolate, it's something that's happened in the workplace, I feel we've got an obligation to help them and let them know they're being supported. And of course, the main thing, we don't want them out in the community thinking, oh, work said go home, so I'll just go down and have a surf, or I'll go down and catch up with my friends down the park or go to a party. They can't do that. So the more you can support them, the better chance they'll actually do the right thing and they'll feel supported. You're going back to work. Now, this is the matrix, and it is quite comprehensive. I'll use that word. And I think the big takeaways from this is from the Department of Health. There's two areas you want to focus on here. And if you look on the left, it's called the lower risk exposure scenario. And Felicia, is that reasonably easy to see? You're on mute.
Sorry, if you're able to make it a little bit larger, it's probably just a tad small.
I'm at maximum. It will be.
That's all right. That's okay. Well, we'll be obviously sharing all of this, so everyone will get all of the materials that we've got here. So, and is there a link somewhere where this can be found? Is this on the DH website?
Yep, it is. It's part of the response kit. We'll have that sent out to you. You will receive that. I think to summarise this, the key thing out of this, we want our staff and ourselves, if possible, to be in that lower risk exposure scenario. If we're in that, if we've had someone on site who is infectious, if we're in that category, we can still stay at work. If we've had people up in this higher exposure risk scenario, they're going to have to go and isolate. So the clear thing to me is if they've been, and you'll see the criteria for this higher risk exposure is face-to-face, less than 1.5 metres, so we're very close, and we're a prolonged period of time, 15 minutes, all right, so or more. And the other thing, it's very interesting, the time is accumulated. So you can't say, look, they came to reception counter and I was very close, it was only 5 minutes. And then I saw them later on and I had to check them in, and that was another 10 minutes. And then they came in and ordered some drinks, and that was another 5. We've got 20 minutes. We've now accumulated that time. So you don't reset the clock. I don't actually understand. I'm not an epidemiologist or anything or a health person, but that's what they've told us. So just be mindful of very close contacts for a prolonged period. And like I said, if you're running, for example, I've done the zip line down at the beach forest, you know, the training people there, you're in very close contact. They're helping with the harness and everything. You're going to be in a high exposure scenario. Now, what are we going to do about that? You know, a lot of your businesses run on that. That's what they do. What we've got to consider is that if I've got someone there that I can try and split that team up. So if I've gone on a zip line between 10 and 11 a.m. and I've been with Fred or Susie, the instructor, I'm a high contact with them. But the next team that came through, I'm not going to be. I'll be in that low risk exposure. So really got to think about this. The time we have people, and we are going to have people in that high exposure risk. Try and minimise that. And if they are, try and split them up. So if one gets infected, we don't take the whole team out. So I know this is challenging, but you really got to think about this, because the last thing you want is just that we had someone came in and we just throw around sort of, I won't say sloppiness, but not prepared. We've just spread it through the whole business and we didn't need to. So I really, you've got to really think about this. How can I split this into different? So high exposure, we minimum staff in that. Low exposure, we want most of us in that area. So hopefully that's, there's a lot in that. They're the sort of the key takeaways I've got out of that. Keep everyone at a lower risk. Got a much better chance we won't have too much disruption to our business.
And just so everyone is aware, as you're turning the slide there, in the chat, Allan's talked about the importance of knowing your testing locations and letting people know where they can go to get tested. Meg has posted in the chat, we actually have on our VTIC hub a list of testing site locations and also applications for isolation payments and also the pandemic leave payment in the event that they actually have to stay off of work. So that can all be found in the VTIC hub, and the link is in the chat there, ladies and gentlemen. Thanks,
Right.
Allan.
Thanks, Alicia. That's great. Yep. Oh, yeah. So very important. The more simplified, more easier we can make for people, for the visitors, for our staff, just the more smoother things will run. And, this isn't it could be a crisis for your business. And just going back to our sort of crisis management, when we work with clients, the more preparation you do, when something happens, it's almost like business as usual. You just flow. You just address it quickly. You've got the tools. You've got the training. Bang, we get onto it, and then we keep moving. It doesn't stop us. So once again, this is why we're trying to encourage you just to be well prepared. And when it happens, you just like, yep, we're ready for this, and off we go. All right. So identify and tell close contacts. For the purpose of undertaking workplace risk assessment and to assist you and the department, consider who the affected person may have recent close contact with. So once again, this is being very clear, the zones or the areas of people in low or in high contact. So you should be able to identify that. And I'd recommend after this session here, just think about your business and think, all right, if we had an infected person came in, who would they interface with? Who would be in that high category and who's going to be in the low category? So you've almost, you all know as you're trading normally now, which one of my staff are falling into the high category and which ones am I keeping in the low. So, and once again, this morning briefing, you've almost got to be quite conscious of it, saying, all right, these people, you're going to be in a high category, you're in a low. We don't want you crossing over, and keep that quite clear. If instructed by the health officials, tell close contacts they may have been exposed to COVID and the requirements of quarantine. It's very unlikely if the department has contacted you, they should take over that. This could be more with your staff. But if the department get engaged, they will usually take carriage of this, but that scenario could happen. And you must maintain the privacy of all individuals involved. So if a staff member, usually a smaller business, everyone probably know, but just in privacy, you can't identify who the visitor was or who the staff member was. That's a privacy matter. If the department did not contact you, you are not required to notify close contacts of the incident, except for your staff and contractors. So people who you've engaged, you're paying them, they're working for you, that's your requirement. So close contact should be isolated and get the COVID test and await further instructions from the department. Now, they may not get any instructions from the Department of Health. They just follow the procedure. Your 7 days, you get your first COVID test, you get your second one at day 6. If it comes back as a negative, you can come back to work. So we just work on that. Now, if you've had somebody who's been there and would have been there, so for example, one of your staff has been infectious, or there's been a guest there and there's been other guests there at the same time who could potentially be a close contact, the department may contact them because they've checked in from the app, but there's a good chance that they may not. We suggest you do contact those primary close contacts if you have their contact details. Now, if someone's come in, they've checked in on the app, you haven't got access to that information. There's nothing more you can do. If there'd been a guest who's checked in, they've purchased a meal, they're staying there for accommodation, and you have their contact details, we recommend that you, out of courtesy, notify them that, look, we've had a positive case here between this date and time. We know that we've identified you were here. We recommend you go and get a COVID test. There's no other obligation on you. We just feel that's a good proactive thing to do, if you like. That once again, there's no rule or mandate around that. It's just a recommendation. And as I said here, they may appreciate that you following up with them. So letting them know. All right. The responsibility of isolation and COVID tests for the visitor is not yours. So if someone is notified through the department, or if you've notified them, there's no obligation for you to check up and say, hey, make sure you're at home checking up. You don't have to worry about that. You are responsible for retaining contact with your staff and contractors by law. So you obviously got a duty of care. So if someone's been in your workplace and they're sent home, you should be doing a checkup on them. And we've heard cases where people just send people home and haven't checked up on them. Now, generally speaking, and I say generally speaking, people contracted COVID, most, they stay home, they do their quarantine and they come back and they're fine. And obviously we've seen cases where people end up in an ICU. So, regular checkup on your staff and contractors, you should be doing that. You all are also required to notify WorkSafe, and we'll just show you the procedure for that shortly. Next one, seek information about the areas that close contacts have been in the venue, who they've been in close contact with, and for how long. This will inform you about possible risks to others, additional areas that may also need to be cleaned and disinfected, and an exposure level. I know this is challenging, and we were having a conversation yesterday about this. I stayed at the Big Four caravan park at Wye River, and I just know the layout of that venue, the kids, the adults going through there, it's fairly hard to zone it. And people would circulate around everything from the games room, the toilet block, the front office. So you're going to get a lot of movement in that. So in those sort of scenarios, is very difficult to get people to pin down where they've been, probably say the whole venue. Other places, I'm thinking maybe the Mantra, Carbathon Lodge, you might be able to just get people to say, look, I stayed in my room. I actually never went into the dining room. I never went to the bar. I never went to the games room. So ask those people, because they may be able to actually say, look, we actually only just stayed the night and then we left. We never actually interfaced any of those areas. So once again, important to try and identify zones and areas and asking the people if they can recall which areas they were in. And just helps you, because we'll talk about deep clean. It's a lot of work. So cleaning, if it's a whole caravan park or whole hotel, massive job. If the people say I was just on that floor or in that one room, we isolate. That's a lot easier for us. You may need to contact other parties, such as your parent company, if you're in a group, a board, investors. So I just think it's worthwhile getting clarity on this and check your internal policies on this. So, and the other one might be your insurer as well. So get some clarity around that now. So on the time, that's just one of the things you'll check up. You might be in I'm just trying to have an idea, but you might be, say, a call. You might be in a group And there may be a policy that if you get a confirmed tier 1, that you need to notify them. So just need to check on that. If the staff are isolating, you may decide to stand them down for that period unpaid. Now, this is a bit of an interesting area. This is, once again, discretionary, but you may stand them down unpaid. And as Felicia just mentioned, there is 2 types of payment. One is for testing. So if you're off work to get a test, that's one payment. And if you have to isolate, there's another payment available. I believe you can't get both payments. You can get one or the other. But the application's all on the hub. My view, if you're standing them down, I'd explain to people that there's payments available and that they should take that up, because you're running a business. Things have been very lean the last 2 years. It's not unreasonable, and it's very common for businesses to stand people down, and then they can then go on to the allowance there with the government's provided, and then when they come back to work, obviously they come back onto their normal salary with you. All right, so this is the confirmed case checklist, and I've got to put my hand up here and say we've actually changed it. We've added stuff, we haven't taken anything off, but we've just added a few things in. So I'm just going to walk you through. This is a great document. So rather than reinvent the wheel, we just tightened it up a bit. So you'll see here, this is this document you'll get, and this is what you do need to complete when you've got a confirmed case. So starting at the fact, we've gone now point 0. And one thing, as I mentioned earlier, is about confirming the fact. So I don't know how well you can see it on the screen, but on the sort of the bottom left-hand side, first one we talk about is minimising or acting on false information. And I talk about the 3 points of validation. So someone rings up and says, I was at your venue and I was, positive and I was infectious, hangs up the phone. I'd want a bit more information before I start closing things down or cleaning. So getting that validation is very important. I've got here dedicated resource to fill out the required paperwork and contact notification statements. Recommended at least half a day. If you get a confirmed case, it's going to take you some time. I suggest you get someone who's a bit savvy, filling out forms, using the computer, because they will have to get on there. These are what we call soft copy documents or electronic documents. They can fill them out and they can email them off. So appreciate someone have to sit in the spare room, out the back, in the office, or in the kitchen or somewhere and actually complete this. So give them enough time to do that. The next one is ask the worker to return home and isolate. So I've talked about that. It just gives you some clear things of what to do there. Notify the Department of Health. You are required to notify the department. That's important, and there's instructions there. Notify all workers, suppliers, and customers. So if it's relevant, if they've been in that infectious time, they need to, or in that area, they have to also be notified, and they actually have to watch out and see if they've got any signs or symptoms, and then they should go and get tested. So it's important they're notified as well, not just the person that's directly impacted. Do not disclose the identity of the confirmed case, mentioned earlier. Now, you do need to notify WorkSafe. That's another obligation, and I'll just show you the next thing here. Should be the next slide. Oh, sorry, I'll finish this off. The other one, complete the workplace risk assessment. I'll show you that form shortly. So there are a number of forms here you need to fill out. Identifying your workplace close contacts, and there is a spreadsheet that's in here. I'll show you that again, and that needs to be filled out. And basically, that's logging all the people who are close contacts, and it's their names, the dates and times, contact numbers, and if they're in isolation. You need to submit the forms, and then you need to identify close contacts, and explain that they need to quarantine. So let them know. Once again, not disclosing the identity of the people. Consider closing or vacating the workplace. I'm going to talk a little bit about that in a minute. And then we need to do the deep clean as required. And our last point, which we've added here, check the media. And I'll explain a little bit more about that. But you need to check what's happening on the media. So I'm just going to step back again, because this is probably one of the key documents. When it happens, if you follow this, to be quite frank, it's follow the dots, step 0, 1, 2, right through to 11. If you follow that and comply that, you're in a good space and you've done the right thing. So this is really a very key document to be familiar with and you follow. You'll also notice that there's what they call hyperlinks. There's links in this. So if you want further information, you can click that link and it'll open up another document if you're on your computer. So you're seeing there, you've got this form open, you're filling it out, and it says, confirm place in the workplace. If you click that, it will take you through and give you more explanation. It'll still save the original document, but it'll also open another page to show you what that's about. Once again, it's even worthwhile just doing a dummy run with this. Once we're finished, we send them to you. Just have a practice run so you get familiar with how to fill it out. If you've got any problems, you can go back to VTIC or your regional tourism board and say, look, I've tried and it doesn't work, or can you walk me through it? You need to know this stuff, because I really do believe most of you, the high probability you'll have a positive case. You need to be comfortable filling this out very quickly. That's a minimum disruption to your business, and keep going. Yeah, so there's the checks that you need to go through. All right, this is a great log. We call them the casual or impacted person. So governments followed the same sort of framework. Interesting that the only thing we actually did have to update this, it's now 7 days for people who are vaccinated, and the 14 days if you're unvaccinated. So it's the only, we just had to update that. That form basically, the facility, the address, contact person, then the person who's been impacted. So it's fairly self-explanatory, what shifts they work, what area they worked in, and you just complete that and fill it out. And that's your log to keep. I mentioned earlier on about WorkSafe. When you go onto their WorkSafe site, and there's links in that checklist document, and it'll take you straight in. You basically put in your venue name, who you are, your contact details, and it'll step you through. I couldn't get past step 2, obviously, because then I have to complete it. So there's 6 steps, reasonably self-explanatory. You do need to complete that. It's one of your requirements. Another document we'll need to complete is what we call a workplace risk assessment. So once you've had the confirmed case, you need to complete this once again, and what actions will be required. So you'll work through here, once again, fairly self-explanatory. These are what we call, again, a soft document. So if you have it on your computer screen, you can actually just fill it out. And what I would do is I would save it with the date. So once I've completed this out, I would save it as, the 21st, 10th month, the 29th day. So you would save it that and then put Outbreak. So if I ever want to search for it, if I put in that date, it'll just bring that document up. Those familiar with saving documents. So, and once again, putting in a little folder for today's date. So if we have to go back there, we've just got that nice, neat folder, because you may get multiple days of outbreaks. You don't want to be trying to find a whole lot of documents on your desktop. You've got one folder, you just save it for that date. I can go in there and all the information's there for me. So this, another document that must be completed. And just the extension of that. All right, now cleaning and disinfecting. This is quite interesting. Close off the affected areas and do not let others use or enter them until they have been cleaned and disinfected. So it's pretty obvious, but as soon as you have identified an area, we want to isolate that area. Now, how do we do that? We can shut doors and that. I always say everyone should have that barrier tape. The police use it, gas and fuel use it, the SES. It's a really great thing to use. Now, look, you can get some people crawl under it, but if you've got that, it's a good chance it'll deter people from going into that area. You've probably got signs that says do not enter or keep out of this area. That's another thing you can use. But as soon as you've got a toilet block, the games room, the restaurant or something, bang, you can wrap that tape up around it, closing it off so you can't get more people in there to get infected. So that's number one. I mentioned earlier on, it seems that the air is probably the circulation is pretty critical. So opening the doors and windows very quickly and try and get that airflow through as quick as you can. It's important. As I say, barrier tape's a good idea to close the area off. Signage in the area that's been cleaned and do not enter. I wouldn't recommend putting signs up saying, COVID hotspot or tier 1 site. I think you could, that could be distressing for people. Just saying area being cleaned, or keep out of this area, something to that effect. All areas, office, bathrooms, etc., common areas, as well as the equipment or PPE that's were used by the person concerned, must then be thoroughly cleaned and disinfected. So now going back to this clean, there's two things when you read the descriptions there from WorkSafe and from Department of Health. One thing is cleaning, so soapy water, warm soapy water, which we normally use. So we first of all need to clean, but that hasn't actually disinfected. So you need to disinfect that area, and they're recommending the heavy strength or hospital grade disinfectant, which you can get. And I recommend go down to your local hardware, Bunnings, supermarket, and get a bit of a supply for that, depending on the size of your venue. A few, those 2 or 3 litre containers, and having that ready, because you don't want to be then sending someone off to buy that. A lot of you probably have it on site, but I'd have that stored away, ready to go. So if you get an outbreak, you can clean that very, very quickly. Obviously the PPE, so it's the gloves. They said with glasses that they're not deemed to be eye protection, so you need some, some proper shield, or the goggles. If it's human waste, or someone's vomited or bled, you should be wearing a gown and further protected with a PPE. But normal, where someone has just been on site, your gloves and your face shield or goggles are sufficient. All right, so there's this again will be sent out to you. There's actually, and someone asked earlier at the start, what does a deep clean mean? It's a good question, because I asked that last year. I said, what's a deep clean? Now, basically, a deep clean is a more thorough clean. We actually clean with the warm soapy water, and then we disinfect. And that is what we deem to be a deep clean, or some even call it a bio clean. Now, very important that you actually have a checklist, and you'll see that in the cleaning kit. And the other thing I strongly advocate is keeping a record of the date and time and who conducted the deep clean. And I suppose the best example to give that is McDonald's. You go in the toilet block there, I think it's every hour, someone has to go in and check, and they sign their name, the time and the date that they did the check on the toilet and clean. Same sort of principle applies, and you keep that as a log. If anything comes up later on, you may be asked by Department of Health. The visitor may come in, or the staff, and go, well, when was your deep clean? Go, yep, at this date and time, we conducted deep clean, who did it? And so forth. So keeping those records, very important. As I said, cleaners should wear appropriate PPE, disposable gloves, or gloves appropriate for the cleaning chemicals being used, safety eyewear, protect against chemical splashes. Now, who does this clean? In the city here, there's a lot of companies, or in the suburbs, in the metropolitan area, there's a lot of companies offering that at the moment. There is a method of claiming money back for deep cleans through government at the moment. I'm being practical here. You might be in a regional area. I know it's a lot of places have been hard to get staff, and particularly cleaning staff. So you mightn't get staff, you mightn't get them on time, or it's a cost factor and you think, I need to keep operating. You can do the deep clean yourself, providing you're following that checklist for the deep clean. You get someone there and you're doing it properly with, I said, the clean, the wash first, and then the disinfectant. You can do it all yourself. So be mindful, if you get that scenario, you can put someone in, and if they're protected, they're safe to do it. So if you're sending staff in there, explain to them, here's the checklist, you need to be fully PPE kitted out, isolate that area, clean it, and then you can open it up again. So you can do it yourself. I think someone asked that before. I did mention before, it's a visible contamination with, that could be vomit or blood, but other body fluids. Cleaners should also wear a disposable apron. So you need to be further protected. Now, this is not clinical waste unless it's a high-risk setting such as a hospital or aged care. So those disposable gloves, the shields, those things can put in your normal waste bin. I'd recommend you clean them, put them in a bag and seal it up, like your plastic or your rubbish bag, but you can put them in with your normal waste. This isn't clinical waste. If it is clinical waste, you need those specially identified yellow bins, which are also seen in hospitals and in aged care. But for you, unless I said it's got human secretions, you don't need to worry about that. All right, yeah, so how to clean and disinfect. Once again, I'm not going to walk through this too much, but there's actually some really good information in here. I would recommend in your venue to try and be vigilant about things like door handles, particularly in places like toilets, the entry, counters, keeping that regular cleaning going through them. There's two reasons that obviously it's going to help minimise. The other thing is that people, visitors there, see that you're taking this seriously and you're making endeavours to make this place safe. Some people are quite, say, petrified, but concerned. And if they can see that you're, showing good practice around this, I think, well, these people are trying to keep this place as safe as possible. So that's good. And the other thing, of course, it's minimising the chance of exposure and putting it through. So, yeah, once again, you'll get that about what to do. FFOS machines, counters, desks, lift buttons, lifts, regular wiping there. Now, you might put in your COVID plan, and once again, that should have how often you do that. But, if I'm in a building in a lift, at least every couple of hours, someone should be going through and giving those lifts, the buttons, the handles, and that a good thorough clean, and tasking someone to do that. All right, review the risk management controls. So review your COVID management controls. This is if you've had a confirmed case, in consultation with your staff and their representative, and assess and decide whether any changes or additional controls measures are required. So if something happens, and we often call this what we call a hot debrief, or sometimes a cold debrief, we've got to look at why did this happen? Is there anything we could do to mitigate this happening again? The person came in and we let them come in behind the counter. So maybe we can put more, barricading in so people don't come in behind the counter. People weren't wearing masks. So think about how this happened and how we could potentially mitigate it. We put that back into the plan and back obviously into our practice on how we work. If you make the changes, should record it and update in your COVID safe plan. So once again, your plan should reflect, all right, we identified that, for example, we weren't cleaning the buttons on the lift or, the doors in the toilets, we weren't cleaning them. We've now made a process that'll be done every 2 hours to keep their ear. Once again, the cleaning regime will give you a bit of indication what areas, how regular they should be cleaned. And again, it's dependent on the traffic. If you're only getting one person in every day, every 2 hours is silly. If you're running somewhere you've got people just consistently going in and out, you might reduce that down to every hour. Now, this is interesting. Social media. Now, the thing is, once you've had a confirmed tier 1, it doesn't matter if it's been notified to the department or internally, go and check your social media pages. And the other thing I recommend is you Google your business name and check the news banner. You may be identified by the media and you don't even know. So once you've got that confirmed case, this should be in your checklist, and I put it there. Remember, the last point 11 is go and check your social media sites, your website, your emails. People could be emailing you. I believe you've had a case there. And also check the news to see, Google your business name and see if it comes up. There is a reasonable chance the incident may be posted or shared on social media and you're not even aware of it. So just be mindful of that. Now, we recommend you do not promote that you've had a COVID incident on your website or your social media platforms unless it is public knowledge. For example, it's in the media so it's on exposure site on the Department of Health website. It's public knowledge. You're in the media, staff visitors have posted about the incident. So it's become, if you like, in the public domain. We then do need to respond, and part of your kit will actually have some sample responses to put up there. Acknowledge the event, basically. We've done a deep clean. Close contact people have been sent home. They're in isolation. We've now business is continuing. If you've got any inquiries, please call us. So there's a script in there for you to put on your social media. It's a media call. You can use that. You can put it on your website. But I recommend you don't go running out there telling the world. There's that many of these sites here. It's to no advantage either. You putting it up on your website, putting it on social media and it's not there. There's no need. You've done all the right actions. You don't need to then tell the world. As long as you tell the key people, follow that procedure, you've done the right thing. Staff, this is just general knowing about COVID, but staff should always be instructed not to post about the incident and seek management support or advice if they have any questions. And it's very important because they may not be informed about the facts and post incorrect information. So, and I've done a lot of media training with you, regional media operators over the years, and I've always recommended you should have a social media policy, and you should be instructing staff not to put things up. So particularly if you've got younger staff, something's happened at work, could be COVID, could be even another thing, has been an incident, and they get on their social media feed and say, oh my God, I wouldn't believe what happened at work today. And they start talking about it. Usually they don't have all the facts, and they'll put it out there. So there's a raft of reasons I won't go into today, but that can be dangerous. So instructing them, if you've got any questions, ask you, and not to post these events on social media. And if it is on social media, you will respond. They don't need to worry about that. It's not their role. We are, as I said, providing a media kit with postings for those different platforms, and a media statement if it's required. So we don't rush out and ring up the media and say, guess what? We've been a confirmed site. If they inquire, you've got a script that you can use to read to them. As I said, they're becoming more common, so don't be alarmed or panic if your venue is listed or broadcast in community. As I said, as of this morning, it's over 3,000 sites, so it's becoming very common. They'll be more concerned about what you have done. And this is where it's critical that you are very clear, you've got a procedure which has been given to you by the Department of Health, you've reported to them, you've reported to WorkSafe, you've had the deep clean, the staff that have been impacted are now in isolation. That's what I want to hear. That's where I'm comforted, not so much that you've told the media. If you demonstrate you've got a robust procedure, they'll be far more comfortable. So that's a key thing. You must continue to meet your OHS duties at all times. This may mean taking steps above and beyond public health requirements to eliminate or minimise, so as far as reasonably practicable, the risk of workers and others in the workplace, such as customers, contracting COVID-19. Now, what I mean by that is that there's some fairly good guidelines, and there's some rules in there, which are from Department of Health, but you've got your own unique business, and I always go back to the fundamentals. Why has all this come about? There's two things. We want to, A, stop people catching COVID, and secondly, we want to stop it being transmitted. So if you walk around your workplace and think, how can I stop people catching it? So, minimising their touch points, wearing masks, vaccinated, sanitisers, open air. And the other thing, how can I stop it being spread? So that's where we're getting these density limits, not getting people queuing out the front where they're up against each other. So just try and think of the underlying principles of what are we trying to achieve here. Then look at your business, go, well, how can I try and make that work best? So all goes back to common sense, which I know as regional tourism operators, most of you have got a lot of that, which is good. Now, last phase I just want to talk about here is the recovery, which is very important. Staff and visitors may be distressed or concerned if they've been impacted by COVID. Important to keep records of all people involved. So we actually in our kit, we call casualties, people who have directly been impacted, and then we have impacted persons. So for example, the person might be infected is, say, the parent. Impacted person is their partner or their children or other people in that group. So the records we keep help us just to know how many people have been impacted. Follow-up and email call is valuable to check how the staff member or visitors are going. Now, as I said, there's no obligation for staff to make sure they're okay. Because the other thing too, and I mentioned this on Tuesday, staffing is a bit of a challenge at the moment in Australia, and particularly in your industry. If I'm a staff member and I'm getting daily calls, say, just checking you're okay, is anything you need, I'm going to think pretty highly of you, and I'll be pretty happy to come back and work. So, I think it's important to keep that communication going. Visitors, once again, your discretion, but if you've reached out to that person, and maybe just an email or a text, just checking you're okay, looking forward to you coming back. We're up and operating again. That could be just a nice, good gesture and a good communication with them. Give them assurance that the deep clean has been conducted, all people impacted have been notified, you've notified Department of Health, and you've followed the COVID safe plan. So once again, these are the things that I want to be assured that you've done. And if you have done them and you're following that, you'll talk with a lot of confidence too, because you've gone through that and you can even explain what you needed to do. You may be contacted by Department of Health advice on remaining open or other instructions. You may. be contacted by them. And obviously they'll give instructions, you have to follow that. If you have no response from the Department of Health, and this is quite likely, particularly as sites increase and exposure, I think we're getting up in high numbers in exposures, people are impacted. Follow the procedure and remain open. So follow that procedure that you'll need to do. So you'll close that area off, you conduct the deep clean, you've isolated the people that were close contacts, you can then open up for business. Unless the department has told you to close, or unless you feel it is unsafe to do so. So that's a discretionary call by you. You followed the procedures. So this is a very important point here. If you had no contact by the department, you're running a business. You don't want to be just sitting there waiting, for days or longer, and you've had no correspondence. So you do the right thing. You isolate the area. You conduct the deep clean as per the procedure, and then you open it up again. Now, if you think, I just feel this is unsafe, I'd straight away be going back to VTIC or your regional tourism and asking them for some guidance on that if you feel. And if you feel that way, just think about your business now. You might even ask them now for some advice before it happens. But so that's what we're advising. If you get contacted by a department, in a sense that could make it easier because they'll give you clear instruction there. If you don't get contacted by them, deep clean, follow the procedure, isolate the close contacts, and you remain open, keep business running. So I just want to keep that clear. If you're unsure, reach out to the Regional Tourism Board or to VTIC. The other thing is it's wise to conduct a post-incident review, and I touched on this early on, as soon as practical after the incident, review how the incident occurred, what worked and what could be improved. There's probably a lot of things you're doing really well, and you probably think, gee, just as well we had isolated zones, we had good airflow, we only minimised the amount of people in that high risk area. So you'll see some things that are working well, tick, we're going to keep doing those, but we must also see other areas that we can improve. So post-incident review, or we call a hot debrief, is not a bad thing. You can also identify, we're doing a lot of good things here, let's keep doing them. And that reinforces the staff. This is why we need to keep vigilant, keep doing what we do. Provide assurance to your staff and visitors that you've received the incident and the lessons learned have been incorporated into your venue and COVID-safe plan moving forward. Now, people might go, well, what are you going to do now? So you tell them the whole procedure, you say, but we've learned some good lessons out of this event, and this is what we're doing moving forward. So, they're just good things to incorporate into your business practice. All right, and we've got good, we're going well on time. So just wrapping up, and I'm sure there's a few questions. A few things I think is these are challenging times. They're challenging for you, challenging for the community, they're challenging for government. So just be mindful of that. Family and friends have been torn apart over its vaccination beliefs, and I have said this many a times to clients and presentations. I think it's very important throughout this that we keep a neutral position. Some people decide not to get vaccinated, some people have their personal choices. All we need to focus on is that we're tourism operators, we're not medical experts, we're not government. We've got to comply with government regulations and rules, so we'll continue to do that. But I think it's important we don't divide people or make any judgments on people's choices one way or the other. Keep positive about it all. It's exciting. We're all about to open and take visitors in, and this is a huge day. I think the relaxing of the rules and lockdown. This is a big shift, and we're launching now into a pretty exciting time, sort of resuming a fairly close to normal from what we've had in the last 2 years. We'll also settle into a new way of life. So this will be, they're talking about the COVID normal now, and we're doing work over in the UK for some big venue operators there, and COVID's just normal. They've got high case numbers. They do have a lot of people in hospital, but life goes on. So we will get into a rhythm about this. So this next few weeks probably a bit challenging and a bit uncomfortable and a bit bumpy. There's a lot of tools there, but once we set into a rhythm, I think we'll find COVID cases will be very norm, and we'll just know the procedure and we'll just live with it. So I think that's just something to remember. This is a little bit testing now, but we will settle into it. You as operators and the community and government. So yeah, in summary, I think, the 3-step we try and prevent always as we can. Be just very, real that it's a high chance it will happen. We've now got our response. We've got a good toolkit to use, and plus the recovery position. That's a good way to be. Reach out to your regional tourism board and BTIC. These guys have got direct links into government. They've got the finger on the pulse. They have got a lot of tools and they can assist you. So don't hesitate to reach on them. Go to the hub first. Look at that. If you still can't work it out, email or give them a call. The details are there. So I think that's, I've got a little survey we'd like you to do at the end, but I'll leave that up. But I'd love to take some, I've got 37, I'd love to take some questions.
Well, we've got quite a few here. So we've got about 35 minutes to roughly work through some questions, Allan. So we'll get on to that. Just with that QR code, if anyone wants to just scan that QR code, you'll be able to do a survey for Allan, which will help us all a great deal. And as we put these further sessions together, which I'm sure we're going to continue to need help on. Look, guys, just a couple of things I want to draw your attention to really quickly. Meg has kindly posted again in the chat. There's a link there for the contact assessment and management matrix that Allan had up on the screen. So if you go into the chat, you'll find the link for that from Meg Jameson. Meg's also put up the link on deep cleaning rebate information. Again, all this stuff is actually found on the VTIC Support Hub. So I would encourage you, if that's not someplace you normally go to, please make sure that that becomes a go-to resource for you. And there's also a link on there for managing business reviews on Google. So all of those things are found on our VTIC Hub, but Meg has kindly put them into the chat for you, which you can just copy over really quickly and save. All right, Allan, if you're ready, we're going to get to the questions. So we'll try to work through these as we did the other day, and we'll do the best that we can to try and get through as many as we can. So first of all, Brendan is based in regional Victoria running accommodation. My question is it, I think we've kind of answered this, just in double checking. He's asking about deep clean. Do we engage to do it, or does it need to be signed off by any authority? Basically what you said can be done on your own if you're comfortable to take that on. Yep. Let's look at this next question here. We have a hospitality venue that operates one team due to staff that only operates one team due to staff shortages. Therefore, we can't have workforce bubbles. If we become a tier 1 site, do all my staff need to isolate for 7 days if vaccinated? And do I need to close my business for that period of time? Yeah,
look, good question. I really empathise with you because this is going to be challenging. What I'd be looking at in that risk matrix, I'd see if you can keep all your staff in that low risk area, that will then mean that they can continue to work. It's the staff that are in that high, closer than 1.5 metres or less than, and for more than 15 minutes, they're in a high risk. So you've got to see, how can I run my business? So if, for example, you've got a dining hall, you might have staff, they're serving, they might bring it out to, say, a table, and then there's another staff member will actually take it the next phase up to the table. So that people bring it from the kitchen up to that main area, they deem to be a low exposure, and the ones that actually pick it up and take the orders and then close and around those people, limit. You might only have one staff there. Once again, I think it's important to educate people. We are doing this, and we, as I apologise, but to minimise the impact of staff, we've put these procedures in. People get it. Look, if you explain, they'll understand that. So you got to think about, how can I keep most of my staff in that low exposure, low contact area. You're going to have some we know are in that high contact, so minimise them. And maybe, as I said, look around your procedures. Dining hall, we bring it out to an area, and then as a transfer, as the next team take it in. I talked about, I'm just trying to think, I'm familiar with the zip line, that the person there, they're close contact. So they'll take a group, I think, take about 6 at a time. So they take them up and they're doing the zip lines. The next team that come through, they're totally independent. So if that person, I ring up, so I was with, Steve on that zip line to go, Steve was a close contact, but Susie, who ran the next team, they're not. Does that make sense? Yeah.
Sounds good. Just a quick one here. Should people have different QR codes for different spaces and rooms?
Yes, yeah, you can. There's two things of that. There's one is that just the compliance. I mean, it gets people go, geez, I have to QR, every time I move. It depends a little bit on your venue. If you've got to once again think the practical application. If I've got someone that comes in on my venue and I can QR them into say their room and say a distinct area, and there's a chance they won't go in those other areas, and yes, that's great, because if they are positive, I'm only impacted that area. If they're going to be moving around just through normal business, say you're staying, and once again, I know if Jenny and Graham are on at Carbathong Lodge, you get to a venue like that, you're in your accommodation, but there's a communal kitchen, there's a communal dining room and lounge room. It's pointless having a QR code in each one, because I'm going to transit through all of those in my stay. But they've got maybe there's a garage, you shouldn't go there. But if you went out to the garage, well, you shouldn't be there, maybe you'd have a QR code for that. So if you've got those common areas, the mantra, for example, you come in there and you check in, there are people in the reception area, then the dining area, and that they're going to transit through all of those.
Yeah.
So I might be able to isolate them in a cabin, for example, and they're out there. Absolutely, because that cabin may be a tier 1, but the rest of the others aren't.
Thanks, Allan. This next question, I might just grab this one quickly. It wants to know about, will these be changing again in January? There's always so many changes, and as a follow-on, how quickly do we normally find out? Look, it is changing. You are absolutely right. These changes come through rapidly. There's no way to tell whether it's going to change in January or if it's going to change even sooner than that. The one thing I would say to you, if you are a member of VTIC, you're getting this information the minute that we find out, because generally when the changes are made, the industry associations are advised quickly by the government departments that these changes are happening, and then we all send information out to our relevant membership base. So whether that's through the VTIC membership base, whether it's through your regional tourism boards, whether it's through restaurant and caterers, whether it's through the Accommodation Association. Right now, I have to say, membership in some association is really, really important. Whichever association you want to belong to, that is the quickest way for you to find out this information, because the associations are apprised of the changes, and then immediately it's up to us to send it off to all of our membership base. So if you have an affinity or an affiliation in that regard, you should be able to find out pretty quickly. Do we need to send all persons home, or should they isolate in their cabin? So I'm taking, if they're guests, would they be able to isolate in their cabin, or should you be sending them home?
Yeah.
Cabin or room, I should say, sorry.
Yeah. My understanding is they can still stay on site if they can isolate. So if you're a remote location, being mindful, that's 7 days. It's are they comfortable doing that? I mean, they are entitled to get in their car and they're in the car and leave, so they can do that. So that's a bit of a call, because you're obviously going to have to. There's a few things they've got to pay for the accommodation. You're going to have to organise or assist them in getting meals delivered. But yet they can, if they can remain isolated. That's probably the criteria.
Yeah, good one. Thanks, Allan. There's a question here about changes coming, and I just read an article about this morning in the paper. Changes coming to how we evidence medical exemptions. Will this go through the Australian Immunisation Register soon?
I can't fully answer that. I know you can get your medical exemption put up on the app, the service app. That can be. There's, I believe, there's ways that people can get that. And that helps to show it's bona fide, but I can't fully answer that, to be honest.
There was, I can only tell you what I read in the newspaper today, because I just read that article this morning coming into the city. And in fact, they are going to start requiring that it is on the immunisation register. They are going to make it a lot tighter. The reasons are incredibly narrow for what you can get an exemption for. But this idea of just going to the doctor and getting them to write you a certificate isn't going to fly any longer. There are changes coming that will make this a lot harder for people to get exemptions. And I think this is coming about because obviously there have been doctors that are just writing exemptions, and they're closing the loop in that regard very, very quickly. So that is coming. And I would suggest you'll need to just continue to watch the news reports.
Yeah. Can I just
yeah.
on that, one thing I do, just be mindful. Someone, and look, I don't know if you're aware, there's a lot of fake certificates floating out there. It's a bit like kids go to a nightclub with a fake ID. It is not your responsibility to get there and interrogate them about the accuracy of that. If someone shows a printed, the green pass, they've printed that off and it's got their name and the dates of the tests and they've got their ID and it matches, there's not much all you can do. If they're falsifying a document, that's not your problem. And if the government or someone comes in, COVID inspector comes in and says that person had a false document, that's not your issue.
Yeah. Good point. Really good point.
And same with the medical. If that looks a bona fide medical thing by a doctor, and they've got ID that matches that, you're all covered, and I'm quite happy to go and help you if that comes, because you've done all the right things there.
Exactly. Just to by the by again, Meg's just so on top of this. Thank you, Meg. She's posted up the article in The Age right now, the links there to vaccine certificates explained and how to prove your status. So that's the article that I read this morning. So you might want to have a quick look at that. Interesting question here, Alan. Does an ozone machine kill COVID?
Interesting. I read up on that. I've learned a lot myself, to be honest, about deep cleans. There's not a high. They question that, and the reason there's a number of machines that can do this. There's gases and ozone, and there's wet, and there's dry, and there's fogs. What they're saying, the problem with those is they don't clean before they disinfect. So if you're going to use those type of apparatus, you actually still have to go through with it. Remember we said the warm soapy water, you go through and wipe everything and clean it, and then you disinfect. So my interpretation, once again, you can see in that cleaning document, if you're going to use those fogs, those dry, you have to actually go through and wash everything down first and clean it, so then it can then disinfect. So it's a two-stage process, whichever you go.
I'm not sure that this is a question here, and I'm sorry, Gez, but I'm not quite sure I understand. Something about he's got a caravan park at Kangaroo Lake. We do have a convenience store with cooking pizzas and takeaway food. So I'm assuming maybe they would have a responsibility to let that convenience store know very quickly, because obviously it operates as almost an adjunct to the caravan park. Maybe, I guess that's the question. Not sure.
Well, that'll fall into a dining. Process. Just once again, just quickly, without even looking at the place, high ventilation, density limits, and even having almost like booking. So between say for dinner time, you say from 5 to 5:30, you will have, say example, 10 people depending on your limit capacity, and then those people leave, and then 5:30 to 6, and that's where I would do a check-in actually. Because I would say, when were you in that location and with those other people? Actually, that's a good point. That is where you might start doing a check-in time, because people go, well, I went there and cooked my dinner at the barbecue thing, and then I left. I was only there for half an hour, but someone said they're an infectious period, and all of a sudden I've wiped out half the caravan park. So that's where it could be a good check-in time. And the only thing is you're going to have to produce a certificate. Put in the check-in for that. So a good point.
For accommodation businesses and check-ins, if we have a group of 60 people, mostly under the age of 15, with no mobile, how do you recommend checking them in?
Good point. There should be as I said, on the app, you can check other people in. If they're under that age, they should have a guardian or an adult with them. I would be putting the responsibility back on them. And maybe that's the good point. You mentioned the other day, this is where you have to really contact your guests ahead of time. Make sure they understand what's expected. So in that instance, referring to what you talked about earlier in the week, Alan, whoever is the guardian that's bringing this group up, and there would probably be multiple adults with a group of 60 young people, they need to know it's their responsibility. If these children don't have telephones to check in, then it's the responsibility of those guardians to make sure that they've got all the check-in details registered in their phones. That's a good point. How can we check in a customer? Hang on a second here. Are you referring to the paper or physical log,
Or is this a feature of either the Services Vic app or some of, yeah, you're talking about checking in on the Services Vic app is what you're referring to, correct? Yeah. I mean, some people can present a physical paper certificate if they have not loaded that certificate into their Service Vic app, but they still have to QR code check in regardless if they have a paper certificate, correct?
Yep, correct. Now you might get some people go, look, I'm here to have a holiday. I'm not checking in. So look, that's not a problem. We're more than happy to check you in. So just let them know. And then what you'll do, you'll just go to your QR code for your business, scan it, you put yourself in, you're there anyhow, and it'll say any other people, you just check them in.
Yeah. That's a good function. I've done that a lot with guests who are with us that don't have a phone or don't know what to do. So yeah, it's a good one. We only do group bookings. Do we need details of all attendees? Usually it's the main organizer and it's their responsibility to ensure guests are COVID aware. I think that kind of relates to the other one, that it's someone, whoever is the kind of organizer of the group or the guardian of the group, the onus could and should fall on them.
Yeah. So just on that, I still think, and look, you'll have the business, but if they can send it's a spreadsheet or a list of the names and mobile number of the people, I'd encourage that. It's not mandatory. Just if you do get a group becoming those 60 kids and then you don't know who they are, it's a bit of a nightmare to try. Once again, getting that intel is good. Just say, look, with the group, you just shoot me through an email of the list and you've just got it there. If you have a break, you've got it back.
Yeah, good point. Next question is a good one. Is it correct that businesses can adopt rapid antigen testing from the 1st of November? Can this be used for both vaccinated and unvaccinated staff as a tool to mitigate the spread? And can rapid testing be used for unvaccinated employees to get them back to work? Now, one point everyone needs to remember, we're quickly running out of time for unvaccinated employees to be in anyone's business. And rapid testing will not cut it. From the 26th of November is probably pretty well the deadline for all of your staff to get vaccinated. So while you might be able to use it in this interim period, it's not going to be a method by which you can get staff back to work that are unvaccinated. But just in that first part of the question around, can they use it for both unvaccinated and vaccinated staff as a tool?
Yeah, absolutely. And look, just my daughter's actually an occupational therapist. She's working for a company that they've actually moved into this area at the moment. And they're at a lot of big sites, hundreds of people working, doing packaging and that. And she, every time she does it, they always get a couple of positives. Now, for them, it's worth the investment. I think, they're not cheap, but I think it's about $12 per test. Now, this is for an outsource. When you buy them yourself, it'll be cheaper. But these companies realise if they have to shut down even to do a deep clean, doing that testing is a lot cheaper. So I think, excuse me, I think you really got to look at your business. They will become available, and I hear they're going to be available at like Kmart and places like that.
Well, Coles is going to start. I heard their first cab off the rank, and then Woolies is going to quickly follow. Don't know what the price point will be yet, but they're going to be available in supermarkets.
So look, I would really, I think they're really worth considering. Someone mentioned earlier they can't create the bubble. Look, I'd be really considering that because look, it might cost you $50 a day to do it. I know it's $50 a day, but the alternative is maybe closing your business down. It may be worthwhile. So staff come in day, anyone's not feeling too good, bang, whack them on that test, and guests come in the same.
Yeah, good points. Next question. This is from Gez, and I think if I recall from another question, Gez has a caravan park. So he's asking, do we have to ask visitors or customers if they've been vaccinated? Now, for accommodation at the moment, accommodation guests do not have to be fully vaccinated at this point in time. And we don't have any indication that will be changing in the near future, because obviously accommodation can sometimes be emergency accommodation, and we need to be careful. We can't refuse people if they're not vaccinated on the basis of, for instance, escaping family violence or their house might have caught on fire. However, we will go back to the point about staff. From the 26th of November, staff in accommodation properties will have to be vaccinated. So guests do not have to be fully vaccinated, and you don't have to ask them. Gez, but your staff will need to be by the 26th of November.
Can I?
Yeah, go ahead.
Just add to that. I was just thinking, I remember going to the Penguin Parade down in Phillip Island. Now, this is quite interesting because you've got, they haven't got accommodation. Imagine they had, say, camping there and you're outdoors. And then when you went inside to either, to dine, you then have to be vaccinated. And if you went into the retail area, you'd have to be vaccinated. So you got some businesses, or so Caravan Park, you can stay there unvaccinated and camp, but then they might have a cafe or a dining area or a retail area. Technically, those people can't go in there.
Yeah, and the other thing is the interesting one too with caravan parks, if you've got swimming pools, again, swimming pools require fully vaccinated. So I would urge everyone, what you have to do is to take a look at that roadmap and take a look at all of the different elements that might exist within your property. So while you have accommodation, you could also have a restaurant, you could have a bar, you could have communal facilities, you could have a swimming pool. Some things require fully vaccinated guests only. Other things do not. So you must look at that roadmap and look at every element that might exist within your property to understand where the fully vaccinated requirements might come into play. That's a good point, Allan. Thank you.
And the other thing, I just once again reiterate, you might get, you probably will at some stage get people who say, look, this is ridiculous, it's not fair, whatever. You don't challenge them on that. What you have to say is, look, I didn't make the rules. This is what government's put in place for us. If I don't comply with this, I'm subject to a $109,000 fine. That'll wipe my business out. I can't afford that fine. So, I'm not here to argue about the rights or wrongs of this, but if I don't follow this, this is what's at risk of me. And they do have COVID inspectors coming out and checking. So I think it's important you always, position is, it's not like I've suddenly decided you can't go in the pool or into the gym or the shop. These are the COVID rules that are being imposed on us. I need to comply or I'm exposed to these significant fines, as they are too.
And one other important point too, just because I know a lot of places have children, at the moment right now, the fully vaccinated is only 16 plus. We won't, once we reach the 90% threshold, which is on or about the 24th of November, then fully vaccinated will be anyone over the age of 12. So at the moment right now, if you've got children under the age of 16, they don't have to be vaccinated, but that will change once we hit that phase D, which is 90%. I mean, look, this one, there's really no answer for why is contact tracing falling on business owners. I think probably the simplest answer is, I think from what Allan has talked about, the magnitude is just growing to the point that it's impossible for any one division of government to keep up with it. So, I mean, I don't know, Allan, if you've got any comment on that one.
Yeah, look, as I said, it's not your obligation to actually be contacting your guests or visitors. It's interesting, that's not an obligation. It is for your staff and contractors that work for you. And you mightn't have it. Someone could come in, dine at your venue, use a credit card. You still haven't got you might have their name. You haven't got a phone number. So there's no legal imperative. So be mindful of that. I think it's the only time will come into play for you is that if someone has stayed there, they're a guest, they've been staying there, they've got their name and phone number, their email. Yeah. My view is I'd reach out to them. But if they've just come into a restaurant and had a meal and left, and that, it's not on you. You can't anyhow. You haven't got their details.
If you have a positive case, the staff member serving them, are they considered a primary close contact?
Depending on once again, you've got to really look at that matrix. It's if they're close to that person within 1.5 meters for more than 15 minutes, that's in that high risk. They're a close contact. Look, this is interpretation. If I'm in a restaurant and I'm taking the order, I could be with that person for a minute, I could be with them for 5 minutes, depending how long they take to, run over the menu. And then I'm coming out and serving. In most cases, I would see that as being less than 15 minutes. So you go into that middle tier, actually. Once again, you really got to be careful and then start thinking about, obviously you want to give people a great customer service. So not saying you've got 1 minute to order and then the staff are almost throwing the plates on the table to not go near people. So we don't want them fearful and doing that. They should be masked and, just being conscious that don't hang around people too long. and we can get us certainly into that middle zone or not the lower zone.
Yeah, I think that probably answers the next question as well, and really referring to that matrix, because they're asking about the relationship of that staff member then interacting with other staff, who's primary, who's secondary. Probably best to refer people to the matrix from what you're saying, Alan. Yeah.
And just once again, going back to thinking, if I've got someone who, I'm just using a restaurant as an example, I've got a kitchen, they're back of house, they shouldn't have interface with anyone really. Then I can have staff going from the kitchen out into the main dining hall, and I might, as I said, put the meals in a spot, and then I have another staff member actually takes them in. And purpose of that is that if the staff that was actually interfacing with customers, and that's probably the highest risk, if they get infected, they sent home, but the rest of the staff keep working.
Okay. I'm not sure if you'll know the answer to this one. Stuart might have to jump in. If you are not contacted by the Department of Health, are your staff still eligible to receive any of the government assistance payments?
Good question. My view is you should. It's an honesty. You go on the website and you would put in that application. A lot of people have been doing for the last 18 months. They've said, look, I haven't been working. It's it's an honest system. They do audits on it. But I'll see if Stuart or has got anything to say. That's a pretty much an honest system.
As far as I understand it, they would still be eligible. Stuart, you've popped in there. Do you want to answer that question?
I believe that's the case as well, Felicia and Alan, that they're still eligible. You want to make sure that you're documenting and the reason behind that, that there is a positive case involved.
Yeah, that's why your documentation as the business owner is so important, because that will align directly to the submission made by the staff member. So, it's important that you get your paperwork in, because then the staff member has the substantiation for their claim.
Yeah, and just on that, just be mindful too, it might be 12 months' time, the ATO give you a call and say, was Allan Briggs working for you? Did you send him home? You go, who's Allan Briggs? Or, I sent him home, but just for a day. So your log is important just to protect yourself, but also the employee.
Next question here is, how do you do the contact tracing, as we don't have access to the Service Vic app? So are we having to keep 2 records? We have lots of walk-ins.
Well, you do have access to the Service Vic app. As long as you've got a smartphone, you've got that. You can go onto the website and generate your own QR code for your business. So I'm a little bit unsure why you wouldn't have that.
Yeah. So once you generate that QR code for the business, you're able to go back and see who's come in on that code. Is that what you're saying?
No, you're not. No, you're not. So I've got one here in my building. If people came in and scanned, I wouldn't actually know who they were. That goes to the government. I haven't got access to that data. The only thing I have access to is, if they write it down on a form, if they've obviously made a booking, they've purchased a meal and used a credit card, and all I have out of that is a name. I actually don't even have a card number, so I don't have much detail.
Yeah, so I think that's probably what they're talking about, is how do they contact other people when they don't know who's checked in on that QR code?
Yep, well, they can't. That's the Department of Health's responsibility.
Right. So that's not the responsibility of the business to do this. So I think we're probably getting into the issue. This isn't about contact tracing. This is about dealing with the immediate people working in your business who have been exposed.
Yeah, your only responsibility.
Contact tracing is still the department's responsibility.
Correct. Your only obligation and legal and moral is your staff and contracts, people you've engaged, who've been on your site, you've employed or paid, that your responsibility. You don't know who they are and where they were. Businesses that come in, as I said, you might want to reach out to them if and you can send them an email, but a lot of them you won't have their details, and there's no obligation.
Okay. And I think the next question that answers it was the same sort of genre of question. So hopefully, Margaret, that answers your question as well. Next one is, if we need to run this process ourselves, what do we do if an in-house guest refuses to go home? How do we enforce this?
Well, they'll have to isolate, number one, because they can't, you say, look, you can't move around. You're an infected person. That's the first thing. They would have to pay. This is an interesting question, because they'd have to, as mentioned before, pay for the accommodation. How they intend getting their meals. Now, either if you've got a restaurant or something, you might say, well, look, we can provide meals, but you're going to have to pay. Or they might say, look, I'll just order Uber Eats and I'll get that every meal. But that's a bit of a negotiation with them and saying, if you do stay, you'll have to stay in that room. You can't come out. You can't come to dining. You can't go to the pool, walk down the beach or in the bush. You've got to stay in that room. It's isolation, and that's what it means. I try to be supportive, but the interaction to me would be, well, wouldn't you want to go home? That does bring down to the point, maybe this is a good discussion. What happens, they've booked a week and they're in day 2 and they say, well, I'll go home. They've been at your venue or infection. Where's the responsibility of that booking as far as refunds are concerned?
Yeah, that's right. That's a tricky one at that point, because if they've already started staying with you, they've stayed within the context of the, at least part of what they've paid for. So I guess it becomes at that point, how you best want to manage that within your business, because there's no rules for that.
Yeah. All right. So I think we should just unpack that a little bit, because I imagine if I was an operator, I'd think that. A few things here. If you got COVID insurance, most insurance, what I'm finding with our insurance, they're not covering it. So that's why I mentioned earlier on about your insurer. Just check what your policy says on that. If you are a venue and it's, you're pumping, you've got a list of people wanting to come in, I think it's an easy decision. So look, we're happy for you to leave. We'll refund you the last, whatever days owing. You'll get in there, do a deep clean, and then you just bring new guests in. If you know you can fill that easily. Otherwise, I suppose it's a bit of a negotiation with the people, Can I just touch on something here? This happened to me many years ago. We had to leave a place due to flooding. It wasn't the venue's place, but it wasn't their fault. But I was a bit disappointed. They said, well, if you leave, you lose it was a caravan park, you'll lose your booking and the money you've spent. And I sort of understood that. But then I thought, personally, the way I would have managed that, I always said, look, you've got, say, 4 days left. You're welcome to come back and use those 4 days in an off-peak time. We encourage you to come back. So I think of ways around these things, because if they come back in an off-peak time, in winter or, on a low season, they probably come back for more than the 4 days. They'll probably buy something at your shop. They may extend longer. And what the other thing is, I think you're a great operator and they'll want to keep using you and coming back. So I think there's sometimes ways of working around this. You don't have to refund the money. You can give people in credit. And a lot of places have been doing that. So just think about how you're going to manage that. So when it happens, you've got a few options there. It's not turning into what do I do now?
Good point. I think this is a pretty straightforward answer. If a member of a group attended the facility, was infectious at the time they were here, we must notify our staff. But what about the rest of the group attendees? Should that fall on the main organizer? I would say yes, because that's their obligation to have all that detail with them at the time they check in. How do you send people home if you don't own a car or use public transport? I think he's saying if they don't own a car and they're using public transport, how do you send them home?
Good point. Because they say, well, I'm going to catch the bus, up the Great Ocean Road. We don't want that scenario. That's a really good point. I'd be calling the Department of Health as some advice. It's got something.
I was just going to say, I think if it's a positive case, Department of Health have this person on there, they'll be talking to these people and they'll be providing advice to them and understand the circumstances, and we'll be giving them advice around how they could possibly. They'll arrange for them to get home, whatever it's required, would be my view.
Thanks, Stuart. Is there a time period in which you must return the form to the Department of Health?
Good point. I don't actually remember seeing that. I think it's in what one would call a reasonable time. So if we had that outbreak today, I would expect that paperwork to go in today, not next week. Now, if you're running a venue and you're flat out, obviously the whole purpose is the contact tracing. We want to minimize the spread. Deep clean, all that you can control within your business. I think you've got to have once again, always go back to a practical approach about this. If it's one of your staff you've identified, they come and say, look, I've had a COVID test, I wasn't feeling well. On this date and time, I was here. I'd then go and look and start doing your tracing, notify the Department of Health fairly quickly, because they want to get on to how many people were there. If there's no one there, it's probably not the burning issue. If you think, gee, we had 50 guests in that time, well, we better get Department of Health on this very quickly. So I'd say that day, the quicker the better. And like I said, there's a bit of time in it, and you may have to notify the Department of Health fairly quickly you've got it, and then start finishing off the rest of the paperwork and the deep clean. But I would expect that day. I don't recall seeing, Stuart, can you help us on that one? But I can't recall seeing any timeline on it.
I would be of the view it'll be as soon as possible, particularly to fulfill your obligations to Department of Health, particularly.
Yeah, I think the term we often use in government is as soon as practical.
Yeah, that's a good catch-all. I'm not quite sure about this one. In a caravan park environment, if a guest tests positive who is considered a close contact, are all guests at the park who have stayed there during that period also considered a close contact? I guess it depends on, gets down to what rooms were they in and how did they use the space?
Yeah, I would say no, unless you've got really tight facilities. Once again, density limits are really good, ventilation, but we've got to go back to the principles. If that person was a positive and they're roaming around the caravan park, if they've gone into the toilet block, they're only usually there for a short period of time, very short, the distance is not close. Once again, closing every second cubicle, sort of, urinal, having people spray, only, 4 people at a time allowed in here. So minimizing the closeness, if you like, of people in there. You wander around, you're out in the open, so put them in that low category. Now, once again, if your venue is something where everyone, you had that's another thing to think of. If I know some parks and some places have a night where everyone can sit around and they have some music or an artist come in and play a guitar or sing, and people and kids used to get into the games room. They're all jumped in there to watch a movie. Really start thinking about that. It's nice if you can still have it, but you might try and have it outdoors and say, look, we just want you spread out so that if there is someone here positive, it's not going to impact the rest of you. So you've got to start thinking of all these little things you've got, activities. The bottom line is, if we've got people in a closed environment and we're in close together, we're in trouble. So the more we can spread them out in the open, we've brought them all down into that low category. They're not deemed to be a close contact. Yeah, so it's a good point. So once again, I think I mentioned earlier, go back to your venue and think about how am I going to minimise people getting really closely together and indoors. We want to keep them outside and keep them apart.
Okay. Look, ladies and gentlemen, we'll take a few more questions, but there's no way there's still 40 questions now because they've just continued to come through thick and fast. There is no way that we can answer all the questions today, but what we will do is we will take all those questions offline and we will seek answers to some of them. I mean, people have just continued to post more questions as we've been talking, Alan, so it's simply not possible, but we'll keep working through a couple more here. The example of zip lines was used, a 5-minute face-to-face contact. This is outdoors. Is it still high risk? Well, I don't think a zip line is a 5-minute face-to-face contact. No.
Not the ones I've done.
Can you answer that one for me? Is that considered physical contact is the question?
Yeah, that'll be a close contact. Well, I only go once again experience. I had the instructor, if you like, they stayed with us throughout the whole journey. Yeah. So that person's a close contact. Now, if I've come up, the person's been with me and checked my harness and it said walk down the walkway there, that's a low risk. So, you might be able to have, multiple touch points where, it's not the close distance, it's the time frame's short, less, very fleeting, they're low risk. So you just got to keep mindful. Otherwise I just throw someone in and I just wear them as being a very close contact, but I keep them with that group and not interfacing with other groups.
Yeah. Okay. I think this is a simple yes answer. Would a local council need to follow the same process if there was a confirmed case in a community venue?
Yeah, of course.
I think it's pretty straightforward. The rules are the rules there, so everyone will need to follow those. If a person does call up and announce they've visited while infectious and then hang up without giving any details, is there any way to confirm anything? I would doubt that.
Yeah, just on that though, as a matter of caution, this is a little bit challenging. I would just go through and as an abundance of caution, probably just doing the deep clean, doing that.
Yeah, just to be safe.
And just ask once again, and we should do this anyhow. Just remind people, if you're feeling unwell, get a COVID test. Here's the locations.
Yeah. Quick one here with relation to QR check-ins in accommodation. What are the requirements of using the QR code? Like on arrival check-in, do they have to check in every day, every time they're entering the premises? How does that work?
It should only be as they arrive. I mean, it's really up to the person, because if, for example, you go into a supermarket, for example, you check in, you want to check out pretty, put the time you were in and out, because if I say I checked in at 9 o'clock in the morning, and say I was there till lunchtime, well, in that 3-hour period, there could have been hundreds of people go through. So you want to, the more you can sort of check the specific time you were there, because they might say, well, you were safe. The period you were there was, you couldn't have had that contact. So, getting pretty specific about the times you're at locations is to your advantage. Yeah.
I'm going to take one last question, and then we're going to have to probably wind it up, ladies and gentlemen. So we will work through all these other questions. As I've said, there's a lot here. So please give us a little bit of time. We're not going to be able to get back to you within a couple of hours, because there's a lot of questions here that everyone's asking. If we have a confirmed case within a caravan park, and I think this would go for any type of accommodation, do we have an obligation to advise all in-house guests that there is a problem, or do we tell the guests to stay in the park, or are they free to leave? That's a tricky one.
Yeah, it is. Look, if you've had someone in a caravan park who's confirmed they were infectious while they were there, I think you've got an obligation to tell people. I would say once again, you've got to reiterate people, we've had this person's notified us, because sometimes caravan parks, they could have been there, some people there for 2, 3, 4 weeks. And then someone goes home or gets a test and then says, look, I was there on this date. Those guests could still be there. It could be impacted. What I would be saying to them is, look, we've been notified. We've identified the close contacts. First of all, we've got a COVID-safe plan. We've activated the plan. We've notified the Department of Health. We've identified our close contacts. They're now isolating, if that's the case. We have conducted a deep clean. At this stage, you're free to stay here. We do ask that if you do feel any signs, symptoms, that you do get a COVID test. And I'd leave it at that and keep operating.
Yeah. And an important point, because there was another question in there as well. You can do that deep clean yourself. You don't have to bring in a professional company to do it for you. Yeah. And just a last one, because there's probably a few people confused on this one, but just some clarity. They're getting confused about whether they have to notify customers who would be close contacts, or is that up to DH? What you're saying is contacting all these, you are not the contact tracers. They're not responsible to do this, right?
Exactly, yeah. Your only obligation, just really clear on this, is your staff, or if you got a contract cleaner or gardener or service person, your responsibility is them, because you've engaged them, so you need to liaise with them. But if other people come in, it is not your responsibility. You notify the Department of Health. They should have used the app and checked in. The Department of Health may ask you, well, do you know who was there at the time? And that's where your records become important, because they'll say, well, no one checked in. And they might put that back on you to say, well, you're not monitoring that. But they might ask you, but you've got no obligation. The only thing we are recommending is that if you know those people, you've got a phone number or an email, I think out of a courtesy and a good business is to say, we have been notified that we had a close contact. We've followed our protocol, COVID-safe plan. We notified the Department of Health. We're just letting you FYI. And they'll probably come back and go, yes, the Department of Health have notified us. Thanks for letting us know. They may say, we didn't know. So,
yeah, definitely. And then, of course, just this will clear off that next question, but obviously notifying WorkSafe needs to be in that mix of everything that happens. So that's a given. That was another question about whether or not they have to contact WorkSafe.
That page we've got to the checklist, if you follow that, and the other thing, I know some people may be fearful, well, these COVID inspectors or the police or council are going to come out and check us and ping us. I always go back, I was a copper, it's what the intent of this is. If you've shown, you've got this COVID-safe plan, you've demonstrated, you've got the QR code check-in, you're doing the ventilation, you've got the deep cleaning kit, people are going to go, look, you've done everything right. You've got it with good intent. Now, if someone slipped in with a false ID, or didn't check in, don't stress about it. Providing you can show the intent, and they'll probably just look around and say, this person is doing the right thing. So, and you can say, look, if we have an outbreak, here it is on my computer. I've got it all ready to go. I brief my staff every day. Here's a printout of the latest rules. You're in a very good position. I'd be comfortable to support you.
Great. Well, we might have to draw to a close there. We still have 35 questions, despite everything we've gotten through, Alan.
Yeah.
Look, as I said, we'll work through these and we will try and come back to everyone with answers to their questions. But Alan, can I thank you, first of all? The information that you share always is just so vital, and you explain it in such a straightforward way, and hopefully everyone has gotten some real value out of what we've been through today, because we are all learning. This is a new world for all of us, so I think we have to step in and we have to support each other as best we can. I just wanted to remind everyone that, we will be sending to those registered for the event today. We'll be sending you the recorded version of the session today. We'll also have all of the materials that Alan has spoken about, so you'll be able to make sure that you get access to all of the checklists and all of the different pieces of communication. And please refer quickly to the chat. There are some great links in there that Meg posted as well that could be helpful for you as I said, we're all finding our feet with this one. So please don't feel like you're just not being able to get it, because I'm quite sure we're all in the same boat. So we're learning every day. Just by the by as well, we've now done 5. Today was the final in our series. All of these sessions are now posted up onto our VTIC hub. There is a segment in there on reopening series, and you'll be able to find all of the information that we've shared across all the sessions. We did one last week on the regional vaccinated economy trials. We also, as I said before, we had Alan with us on Tuesday, and he talked about managing aggressive behavior in your business. We also did one on Wednesday with Visit Victoria in the launch of their new Travel Kind campaign, something really, really important for us as we're stepping into where we are today. And they also talked about some other marketing initiatives that they're doing to support our reopening, both at a regional level and Metro Melbourne. And then yesterday we did a session on back to work well-being and how do you support your staff in what can be a quite anxious time for them as well. And of course, the session today with Alan around should you find that you have a COVID positive case in your business. So all of those will be loaded up into our VTIC support hub. Again, if it's not something that you have looked at before, I would strongly encourage everyone to kind of bookmark that and really be looking at that on a regular basis, because we're keeping all that information up to date as soon as we hear it from government. So that was a really big one, Alan. We could have gone on for 3 hours, I reckon, but look, thank you so much. It's always a pleasure to have you with us, and I'm sure we're going to be seeing a lot more of you in the coming weeks and months.
Hopefully out at camping grounds and.
Oh, that's right. Well, let's hope we're all getting out and about somewhere this weekend. It'll be marvelous, really, and great weather as well. We're supposed to have. So, yeah, the weather gods are smiling on us this weekend and the next couple days. Yep. So, thank you again, Alan, and thank you to everyone on the call. Thank you for your patience. We've tried the best we could to get through as much as we could, but clearly and obviously there would be a lot of questions today. So we'll work through that as best we can. And take care. Everyone have a great weekend. Hopefully you're going to be really busy, and it will be a great opportunity for us to roll up our sleeves and get back to what we love doing. So thanks everyone so much. And thank you again, Alan. And thank you, Stuart, for being with us today.